Assalamu alaikum. This is lecture number 2 for the second semester of medical parasitology. At the end of this lecture, the student is able to define the commensal amoebae in human intestine and why we study them. Also, he can list and describe the commensal amoebae in the human intestine, define the free-living amoebae, and list the disease causes by these free-living amoebae. In this lecture, we will study commensal or non-pathogenic intestinal amoebae in human. They are Acanthamoeba coli, Acanthamoeba hartmanni, Acanthamoeba gingivalis, Endolima xnana, Acanthamoeba buccinei, Acanthamoeba fragilis. It is non-pathogenic amoebae, not cause any disease for a human. So why we study them? We study them because they may be mistaken in diagnosis the pathogenic amoebae in human intestine, and it is indicator for the contamination with filthy material of food and water consumed by human, so it is indicator if this food and water contaminated with feces of a human. Acanthamoeba coli, Acanthamoeba hartmanni, Endolima xnana, and Acanthamoeba buccinei are the most common non-pathogenic present in the lumen of large intestine, the lower level. It is worldwide distribution. Their life cycle similar to that of Acanthamoeba histolytica, but they does not have any invasive stage and does not ingest RBCs. Acanthamoeba gingivalis is the parasites of mouth of man and other mammals, found mostly in diseased gums and teeth. We will start with Acanthamoeba hartmanni. It contains trophozoite and cyst stages. Trophozoites measure between 8 to 10 micrometer. A nuclear structure contain peripheral chromatin dot with a small central karyosome. It is resembled to the Acanthamoeba histolytica in shape. So we have, as we say in a previous lecture, the small race amoebae, we call it Acanthamoeba hartmanni, and the large race, we call it Acanthamoeba histolytica. The small race, or in other word, Acanthamoeba hartmanni, measure less than 10 micron. It is designated species in 1957. طبعا القياسات هنا فقط للاطلاع ليست للحفظ. A cyst of Acanthamoeba hartmanni measure 6 to 8 micrometer, contain 4 nuclei in mature cyst, contain blunt cigar-shaped chromatoid bodies. Chromatoid bodies persist in mature cyst only, as we see in this picture. The second commensal amoebae, Acanthamoeba coli, their trophozoites measure reach to 30 micron, broad blunt pseudopodia, the nucleus with a thick nuclear membrane, moderately large eccentric karyosome with chromatin clumped irregular on the nuclear membrane. مثل ما نلاحظ بالصورة إنه تحتوي على eccentric karyosome و irregular nuclear chromatin dot arranged in the nuclear membrane. Acanthamoeba coli trophozoites contain a granular cytoplasm, contain vacuole with ingested bacteria and other food particles, but there is no RBCs in this vacuole like Acanthamoeba histolytica. Also, the ectoplasm and endoplasm not well differentiated as we see it in the Acanthamoeba histolytica. While Acanthamoeba coli cysts measured reach to 25 micron, contain 80 nuclei in mature cysts, These nuclei have the same characteristic features of the nuclei of trophozoite, with eccentric karyosome and irregular chromatin dot. Also this cyst contain chromatoid bodies تكون حادة النهايات مثل الزوايا يسمونها splinter like. Glycogen is usually diffuse, but in young cysts is occasionally found as well-defined mass, which is stained reddish brown with iodine. The other commensal amoebae, Intestinal gingivalis, it's found in the oral cavity, not in the large intestine, in disease gum and teeth. It has only trophozoite stage, no cyst stage. Their trophozoite, it is identical to Entamoeba histologicae, contain few to several finger-like pseudopodia, and the endoplasm finally granular. The nucleus contain small karyosome, may be central or slightly eccentric. Intestinal gingivalis have been found in the bronchial washings and vaginal and cervical smears, where it can be mistaken for Entamoeba histologicae. Endolima xnane contain two stages, trophozoite and cyst stage. The trophozoite measure reach to 10 micrometer. Motility is sluggish with blunt hyaline pseudopodia. The nucleoplasm is finely granulated with minute vacuoles. In nuclear structure, there is no peripheral chromatin and contain large eccentric karyosome, as we see in this picture. Endolima xnane cysts measure reach to 8 micrometer. They can be spherical or ovoid in shape. Contain 4 pinpoint nuclei, which are highlighted by the addition of iodine stain. Chromatoid bodies are not found. Glycogen is diffuse. Amoebae buccelli also contain trophozoite and cyst stage. The trophozoites measure reach to 15 micron. Cytoplasm granular contain vacuoles with ingested bacteria and debris. Nuclear structure, no peripheral chromatin, and contain large karyosome. Amoebae buccelli cyst measure reach to 12 micrometer, contain one nucleus, eccentrically placed. Chromatoid bodies are not present. Glycogen is present as a compact, well-defined mass, staining dark brown with iodine. The arrows pointed to the glycogen mass after staining. Amoebae, it is Dientamoeba fragilis, previously considered as amoebae, but now reclassified as amoeba flagellate based on the electron microscope study and antigenic similarity to Trichomonas, because it contains pseudopodia and flagellum for their movement. It contains trophozoite stage only. There is no cyst stage. Their name derived from Dientamoeba because it contains two nuclei, as we see in this picture. And the chromatin, nuclear chromatin, it is fragilis, هشة أو مكسرة على شكل حبيبات كما نلاحظ في الصورة. Amoeba fragilis live in the large intestine, in the colon, crypts, feeding on bacteria. The trophozoite measure reach to 12 micrometer in diameter. It is transmitted from person to person by fecal-orally transmission, and also by the eggs of Enterobius vermicularis and other nematodes, which may serve as a vector to these parasites. Dientamoeba fragilis, formerly believed to be non-pathogenic, but now being associated with a variety of symptoms like intermittent diarrhea, abdominal pain, flatulence, anorexia, nausea, malaise, and fatigue. High incidence is seen among children between the age 2 to 10 years old. Laboratory diagnosis made by demonstration of trophozoite in stool. At least 3 stool specimens should be collected over a period of 7 days. The treatment is metronidazole, iodoquinol, barmomycin, and tetracycline is used. This picture indicating the intestinal amoebae characteristic feature for the troph and cyst stage if present. Also in this lecture, we will study the pathogenic free-living amoebae and human disease. We have a free-living amoebae, and when introduced to the human, may cause disease and become opportunistic parasite. Free-living amoebae, the majority of protozoan species are free-living and have little impact on human health. Can be found throughout the environment and are particularly abundant in soil and water. Some free-living amoebae can cause pathology if introduced into the human home. The pathogenic free-living amoebae, we will study Naegleria fowleri, which is caused primary amoebic meningoencephalitis, BAM, and Acanthamoeba species caused 3 disease, granulomatous amoebic encephalitis, GAE, granulomatous skin and lung lesion primarily occurs in immune-compromised person, and amoebic keratitis. We will start with first free-living amoebae, Naegleria fowleri. It is commonly found in lakes, swimming pools, tap water, and heating and air conditioning units. Naegleria fowleri produce an acute and usually lethal disease in central nerve system called BAM, primary amoebic meningoencephalitis. Naegleria fowleri occurs in 3 forms or stages: cyst form, amoeboid trophozoite, and flagellated trophozoite. We will start with a trophozoite stage. The amoeboid is elongated, broad anteriorly, vary in size, around 7 by 20 micron, with single pseudopody, as we see in this picture. The amoeboid trophozoite in water transform to flagellate form. It is biriform with 2 flagella at broad end and a clear contractile vacuole present. This form moves rapidly or spine in a circle. The second picture for the cyst, it is spherical, smooth, thick wall, and uninucleated. Its measure 7 to 10 micron. No cyst seen in tissue. For the life cycle of Naegleria fowleri, it's completed in the external environment. The amoeboid form of trophozoite multiply by binary fission. Under unfavorable condition, this forms transfer to cyst stage, undergoes excitation in favorable condition. The flagellate form of trophozoite help to spread in new water bodies, and the amoeboid stage, it is effective for the human. Typically, infection occurs when people go swimming or diving in warm fresh water, river or ponds, and poorly maintained swimming pools, or nasal irrigation using contaminated tap water. This infection occurs when the parasite amoeboid form migrate to the brain via olfactory nerve, causing BAM, primary amoebic meningoencephalitis, in healthy individual. Pathogenicity and the clinical features, patient mostly healthy young adult or children. The incubation period varies from 2 days to 2 weeks. In incubation period, the patient experiences insomnia. The disease advances rapidly, causing fever, headache, vomiting, stiff neck, ataxia, sneezer, and coma. Cranial nerve paralysis, especially of the third, fourth, and sixth nerves, have also been documented. The disease almost always ends fatally within a week, on the average 5 days. Diagnosis by demonstration of trophozoite in CSF, but the diagnosis is usually done in autopsy because it is very rapid, acute, and lethal disease. A treatment for non-survivors treated with amphotericin B. The second free-living amoeba can cause disease in human Acanthamoeba species are opportunistic free-living amoeba capable of causing Rhinomatous amoebic encephalitis, GAE, in individual with compromised immune system. It's occur in two forms or stages, trophozoite and cystic stage. The trophozoite, irregular shape with spine-like podia, we call it Acanthamoeba. So the species, we call it Acanthamoeba because of the shape of this podia. And its measure reach to 20 micron. This picture indicating the Acanthamoeba trophozoite in culture. The cystic stage is spherical with double wall, the wall either smooth or wrinkled, as we see in this picture, wrinkled مجعد. Life cycle of Acanthamoeba species can be completed in the external environment. We have two forms, trophozoite, reproductive and under favorable condition by binary fission, and under unfavorable condition transformed to the cystic stage. If introduced to the human, can cause disease. It is opportunistic parasite. Both cyst stage and the trophozoite, it is infective to the human, can be entered to the human by three ways: through the eye and cause eye keratitis, or through the lung vein to the central nerve system, or through the ulcerated or broken skin. We have three types of disease. We have severe keratitis for the eye and granulomatous amoebic encephalitis, GAE, disseminated disease in individual that with immune compromised. We can be diagnosed by cyst and trophozoite present in tissue. بعكس النيجليريا فاوليري فقط التروفوزويت كان يظهر داخل التشيو وفقط هو يكون الانفكتيف للهيومن. Pathogenesis and clinical features. Infection usually occurs in patients with immune deficiency, diabetes, malignancy, malnutrition, system lupus erythematosus, or alcoholism. يعني اللي عندهم مشكلة بالجهاز المناعي لأنه opportunistic parasite. The parasite spread hematogeneously into central nerve system, subsequential invasion of the connective tissue and indication of pro-inflammatory responses lead to neuronal damage that can be fatal within days. A post-mortem biopsy reveals severe edema and hemorrhagic necrosis. As we say, both trophozoite and cysts can present in tissue. As we see in this picture, the first picture, it is for Acanthamoeba trophozoite present in eye tissue and corneal scraping, while the lower pictures for the cyst stage brain tissue. Diagnosis, trophozoite and sometimes cyst stage can be detectable in the histological examination, brain tissue, skin, and cornea, or corneal scrubbing. Treatment for all Acanthamoeba, no human cures documented. Amphotericin B is the drug of choice. Amoebic keratitis, predisposing factor, ocular trauma, or contact lenses, contaminated cleaning solution lead to infection with Acanthamoeba. Symptoms, ocular pain, corneal lesions, refractory to usual treatment. Diagnosis by demonstration of amoebas in the corneal scrubbing. Treatment difficult and limited success. Corneal graft often required. This table differentiates between Naegleria fowleri and Acanthamoeba. They are both free-living amoebae. This table differentiates by the disease name, portal of entry, clinical course, pathogenicity, morphological forms present, and the morphological forms of trophozoite, cyst stage, and etc. By this slide, we reach to the end of our lecture. Thank you for your listening.